Hi, how are you doing? My name is Dr. Ian Alonjung. I'm going to be your pharmacist for today. And before we start anything, I'm going to just ensure your privacy by closing the door. Okay, so before we start with anything today, I'd just like to ask you a couple of questions. What is your first and last name?
Alice Fitzgerald.
Alice Fitzgerald? Okay, would you like to be called Alice, Miss Fitzgerald, Miss Alex?
Alice is fine.
Okay, that's good. So tell me, what brings you here today? What seems to be the problem with you?
I have pain in my left leg.
Pain in your left leg? Really? How long have you had this pain?
A few weeks.
A few weeks? Okay. Was it something you ate, or did you get hurt, or what was it?
I was running and I don't think I stretched correctly and it started to hurt and I didn't think much of it and I just kept running each and every day and then after that it just became like a sharp pain that I couldn't barely move.
Okay, so what we're gonna do is we're gonna take some of your vitals, from your weight, blood pressure, etc., and then see what really seems to be bothering you. So before anything, I'm just gonna make sure I sanitize myself. Put on some gloves. Just got the wrong one in. Okay, so if you just follow me, we're gonna just take your weight. Just follow me. And then you're just gonna stand right there. Okay, and that seems to be your weight. Okay, perfect. All right, you can take a seat. Okay, so tell me your height. What is your estimated height?
I'm 5'8.5".
5'8.5"? Okay. Okay, and your weight? Not to worry, I won't say it out loud. Okay, so I have a couple of questions concerning your pain. So, have you ever experienced this pain before? Okay, how often do you experience it? Weekly, monthly, every 3 hours?
Ever since it started, it was sort of there when I put pressure on my leg.
Okay, and how long does it last?
Usually as soon as I take the pressure off, it kind of just dissipates.
Okay, and is there anything you've noticed that triggers that pain on your leg? Anything?
When I put more of my weight on it.
All right. Okay, so I want you to describe the pain on a scale of 1 to 10. How would you rate it?
An
An 8? Okay. So you said you feel the pain on your left leg, correct? Okay. So is there anything that can, like, what is it that makes the pain feel a little bit better or makes it go away temporarily? What is it?
Usually when I put more weight on my right leg or I just don't like walk too much.
Okay.
And comfortable shoes help a little bit.
Okay. And do you notice any other symptoms besides the pain on your leg? Anything else per se?
When it gets a little more excessive, I feel like a shortness of breath.
Shortness of breath. Okay. Sure. Okay. All right. So can you stretch out your right arm for me? Perfect. Okay. All the way. So I'm going to pump it and then I'm going to take the blood pressure. Okay. So your blood pressure came out to be 117 and 73. So I'm gonna write that down. Are you feeling okay? A little bit nervous? Oop. Okay, so what we're gonna do is we're gonna do a couple of exercises to test your cranial nerves, okay? So I want you to stand up. You could just stand up for me. All right, so I want you to cover your eyes. And the first thing I want you to do is I want you to get a good whiff of this smell and then tell me what you smell.
Rubbing alcohol.
Rubbing alcohol? Yeah, that's right, perfect. It's hand sanitizer, it has some ethanol on it. Okay, perfect. Okay, the next thing I want you to do, I want to test your dilation of your pupils. So if you could just open your eyes up wide, space thing a little bit. Okay, there we go. Left eye, right eye. Okay, perfect. All right, so the next thing I want us to do is facial expressions, and I want to see you smile. Smile as hard as you can. Okay, now I want you to frown as hard as you can. Now I want you to give a very confused look. Okay, perfect. Okay, so now what I'm going to do is I want to see how fast and slow you blink. So I want you to blink as fast as you possibly can. Okay? All right. Now I want you to blink as slowly as you can. Okay? Okay, perfect. So now the next thing we're going to do is we're going to just try and test your hearing. So I want you to cover your left ear. All right, now I want you to tell me where the sound is coming from.
Up, right, down, down, right, up.
Okay, all right, I want you to cover your other ear, and we're going to do the exact same thing. All right.
Left, up, left, down, left.
Okay, perfect. All right, so the last thing we're going to do is I want to see you rotate your neck in a clockwise motion. Let's see if you can do that. Okay. 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 Okay, perfect. Now I want you to do an anti-clockwise motion. Okay. All right. Okay, perfect. All right. Okay, so I think that's all the assessments we have for you today. So what we're going to do is one of the form techs is going to write your prescription, and you're probably going to take it about once or twice a day, and it's probably going to be after you eat something. It should help with your leg pain. And in a couple of weeks, you should be good. And if you have any other questions, you can feel free. You can feel free to just come by and then ask a question. Somebody will be able to assist you. But otherwise, if you don't have any other questions, I wish you a very good day. Okay.